And welcome back to Life Unrehearsed. Matt Del Vecchio here, specializing in home care, elder care planning, and the senior living industry. You know, we all know about the long waiting times to get into emergency rooms in Quebec. However, time and time again, I hear from many people that once you're being treated, you are in good hands. And it's true. And it's not by chance. There's a lot of hard work and training that goes into emergency rooms. And one of the leaders in the country is the Jewish General Hospital. To tell us more, I have on the line Dr. Errol Stern. He's the director, Jewish General Hospital Emergency Medicine Simulation Program, and the director of the Emergency Medical Simulation Program at the McGill Teaching Hospitals. And I also have Jamie Fizet, who's a nurse facilitator at the Jewish General Hospital's Emergency Medicine Simulation Center. Welcome to both of you.
Hi.
Well, thank you so much for coming on the show. Just love this simulation center. Let's hear more. So we're going to start with you, Dr. Stern. What's the concept of the Emergency Medicine Simulation Center?
The concept of the Emergency Medicine Simulation Center is to reproduce the ER resuscitation room and place healthcare professionals in the simulated environment. We recreate real and simulated cases such that our trainees, as well as practicing physicians, nurses, and respiratory therapists, can work together as a team to achieve successful treatment of common emergency presentations, as well as what we call HALO cases. That's high acuity, low occurrence cases. In other words, emergency medicine presentations, which are rarely encountered but need expedient care. So just like you expect your Air Canada pilot and crew to practice emergency situations in a flight simulator, you want your healthcare professional to have prior experience with your life-threatening problem, or at least in a simulated environment. So just as in real life and in simulated environments, the healthcare professionals listen to the patient's symptoms, examine the patient, which in today's world means using bedside ultrasound, and we order the appropriate lab tests, x-rays, imaging, CT scans, while we treat the patients concurrently. So just like in the aviation industry, we want our team to learn and practice crisis resource management, or CRM principles. In the aviation industry, the CRM stands for crew resource management. So let's just talk about what that really means. Jamie?
So one of the things that means is working in a multidisciplinary team dynamic. So basically, we want to know how our team is organized, who the players are, the understanding of each person's roles and their responsibilities, so we know what to do in those moments. So a lot of these simulations will begin with the nurse assessing a patient that is deteriorating, and it's really important for someone to know when to flag that, hey, I need more help, know when to call for it, and so those are a lot of our simulations begin with that. It also lets us know when to use different available resources that we have, including our human resources. So, you know, I'm in a room, I need to speak to a doctor, I know when to call, and
we put that all in a simulated environment. Yeah. So it's really important that the team works collaboratively together, you know, so that there is certainly a leader, you know, just the doctor is usually the leader, and just like the pilot on the plane or the captain of the boat, they really have to direct the action and make sure that everyone knows their role. But very important, the leader needs to share his or her mental model and basically seek for the input of all team members. That is kind of the followers, right. But very important is the team dynamic.
Yeah, I love that approach, and very comforting, quite frankly, to hear this, that when you are going to emergency, a lot of this training is being done. Great to learn, I'm sure, from students and staff and healthcare professionals. You know what, you can make mistakes during this training center and not be overly concerned, so that when it is live, they could act appropriately. So, and I love the multidisciplinary approach. And, you know, listening to Life Unrehearsed, Matt Del Vecchio here, and talking with Dr. Errol Stern and Jamie Fizet from the Jewish General Hospital's Emergency Medicine Simulation Center. I would imagine, Dr. Stern, technology plays a big part of this. Can you tell us a little bit of some of the state-of-the-art equipment you have at the Simulation Center?
Well, I guess I have to give you kind of the setup, what we have. We have 3 rooms. The first is the simulated resuscitation room, which I kind of mentioned, which has a mannequin and monitor and various pieces of equipment like a defibrillator, a simulated ultrasound, and lots of cameras, actually, and AV equipment. Then there's the control room, in which the facilitators use the action through a 2-way mirror and the cameras that I mentioned. And lastly, which is kind of important, we also have an observation area where we broadcast to other learners or healthcare professionals what's happening in the room. With respect to the mannequin, it's very engaging because he talks. He has a conversation with the team. Actually, his voice is one of the facilitators in the control room. He's kind of like a Wizard of Oz in the background. But the mannequin, he blinks, he breathes, he has pulses, and he has simulated vital signs that's all displayed on a monitor, which is controlled by the facilitator in the adjacent room. So the mannequin actually is so sophisticated that the lung breath sounds and the heart sounds can actually be modulated, which can be appreciated with a stethoscope. But more importantly, in modern day, we display the bedside ultrasound videos, which are on a second screen, which we also use to display the lab results, the x-rays, the CT scans, and all this is broadcast to observers in an adjacent room.
You know, it's just amazing, and I'd love to know. I like the Wizard of Oz analogy in the control room and so on. So, how is feedback provided to the users in the simulation center?
Well, feedback is key, really. I'm glad you asked about that because I always say it's just the whole simulation experience is just an excuse to debrief so that everyone could really think about what happened and to kind of say what they could have done better. We actually kind of want mistakes to happen because this way we can improve our performance every time. So it's actually something that's almost rewarded in this environment. We really want, the debriefing starts with a very strong emotional release because you can imagine it's very stressful. We want to know how people felt just in the room. And people really need to express their emotions before they're able to move on and discuss it more in depth. And debriefing takes on various forms, kind of like what went well, what you could have done better. But most importantly, the facilitators want to maintain a genuine curiosity regarding the performance of the resident or the staff. They want to appreciate their frame of mind leading to their actions, explore their thought process, and actually promote dialogue and self-reflection.
You know, it's amazing. And I guess every one of these experiences of the debriefing might be a little tough on the ego, but I'm sure it's appreciated. And they take these, like you say, live in the emergency rooms. We're running out of time. Just very quickly, I would imagine you have to create different scenarios. Just give us a number, if you will. How many types of scenarios can actually be created in the simulation center?
Endless, really. It's really actually what it is the number of cases that you see in your practice.
Right.
So we actually ask all our emergency residents to create and facilitate at least one simulation scenario during their training, and we actually encourage them to take a challenging case which they cared for, and then we help them develop the scenario. We teach them how to debrief, and it's really a vigorous peer-to-peer learning experience.
Love that. Just great. Well, you know what? We're already out of time, but I want to thank you very much. Just amazing to hear about this and very encouraging from hearing from a layman. And if we do have to visit the emergency room, I want to thank you very much, both of you, Dr. Errol Stern and Jamie Fizet. Dr. Stern, how can our listeners contribute to the Simulation Center?
Well, we do have a fund. We're always looking for funding. It's called the Dr. Stern Simulation Education Fund. And you can reach the JGH Foundation, the Jewish General Foundation, and that phone number is 514-340-8251.
All right. Well, thank you very much. I'll repeat that number one more time, 514-340-8251. And it's the Dr. Stern Simulation Education Fund. Congratulations, by the way, really at the forefront of technology, and wish you continued success.
Thank you so much.
Thank you very much.
All right. Thank you. That's Dr. Errol Stern, Director, Jewish General Hospital Emergency Medicine Simulation Program, and Jamie Fizet, who's a nurse facilitator at the Jewish General Hospital's Emergency Medicine Simulation Center. Thank you both very much. Coming up, a dynamic mother and her son who is on the autism spectrum, and they design and produce unique handcrafted greeting cards. Can't wait to talk to them. That's coming up next. But first, a CJD Traffic Center update.